We spend so much time thinking about protecting our pets from, well, things we can see: cars, toxins, getting lost.
Right. The obvious danger.
Exactly. But what about something invisible? Like, something as seemingly harmless as a sunbeam they're just lounging in. Could that actually be a hidden danger, particularly to a very specific kind of sensitive spot on their body?
It's a surprising vulnerability, isn't it? And it's precisely what we're unpacking today.
Okay.
We're taking a deep dive into nasal planum squamous cell carcinoma, bit of a mouthful,
Yeah.
which is a type of skin cancer that specifically affects, well, the tip of an animal's nose.
The nasal planum, that little, often moist, hairless patch right at the front. We've gathered a stack of clinical guides and expert reviews on this condition to bring you the most important insights.
Yeah, and our mission here is really to be your guide through this source material.
Hmm.
We want to understand exactly what this cancer is, crucially why it happens, who is most vulnerable, what the early signs look like because they're often missed,
Yeah.
and then how it's diagnosed and treated, and maybe most importantly, what you can potentially do to prevent it.
So consider this your essential shortcut to getting well-informed on nasal planum SCC.
Exactly.
So let's get right into it then. At its core, what exactly is nasal planum SCC?
Okay, so think of it as a malignant tumor. It arises from the squamous epithelial cells.
Huh?
These are the sort of tough protective cells that form the outer layer of skin, but in this case, they're specifically turning cancerous right there on the nasal planum, that hairless nose pad.
And that's strictly the nose pad itself, not like up inside the nostril.
Precisely. It's quite distinct from SCC that might occur inside the nasal cavity. A key characteristic of this nasal planum version, based on these sources, is that it's highly aggressive locally,
Locally aggressive, meaning?
meaning it tends to destroy tissue right where it starts. It sort of eats away at the nose pad itself. However, and this is a really important distinction, it generally has a low potential to spread elsewhere in the body.
Oh.
Low metastatic potential, especially early on.
Okay, so the main battleground is right there on the nose.
Yeah,
That sounds like a pretty significant point for treatment strategy, I imagine.
it absolutely is.
Now, who is most likely to get this? And why? You hinted at the sun earlier.
Yes, the why is, well, it's a big takeaway here, really. Chronic UV radiation exposure is identified as the primary cause,
The main culprit.
the main one. Over time, that sun exposure damages the DNA in those squamous cells, and that eventually leads to the cancerous transformation.
So it's not just like an association, it's the direct mechanism. They think the UV is actually causing the DNA damage.
Exactly. And this directly explains why certain animals are far more susceptible.
Right.
Those with light pigmentation. Think animals with white fur, pink skin, or just light-colored noses. They simply lack the protective melanin pigment that helps block those UV rays.
Makes sense.
And naturally, outdoor access significantly amplifies this risk, particularly for cats who, love basking in sunbeams.
Oh, definitely. So what about specific types of animals? Is it more cats or dogs?
Well, it's actually the most common tumor found on the nasal planum in cats.
Really? Most common.
Yeah, but it's less common in dogs. In cats, it overwhelmingly affects white or lightly pigmented cats who spend a good amount of time outdoors. And it's not uncommon to see them develop SCC on other sun-exposed areas too, like their ear tips or maybe their eyelids.
Oh, interesting. So it can show up in multiple spots.
It can. And they tend to be diagnosed later in life, typically between, say, 8.5 and 12.1 years old, according to the sources.
Okay. And dogs, are they affected in the same way? Is it the same risk factors?
Dogs can certainly get it, and again, it's often seen in those with light-colored or depigmented noses, linking right back to that UV exposure.
Uh-huh.
However, one study mentioned something interesting: an overrepresentation of males, and surprisingly, Labrador retrievers.
Labs. But they're typically dark-coated, aren't they?
Exactly. That's the fascinating part. If UV is the primary driver, how does that make sense for a dog like a lab?
Yeah, do the sources explain that?
Well, they aren't definitive on the lab link. They sort of suggest that in some breeds, other factors, maybe genetic predispositions, might be playing a role beyond just UV sensitivity.
Okay.
But for most cases, especially in those pale-nosed dogs and cats, the sun connection seems very strong. Dogs tend to get diagnosed around 9, 10 years old, similar age range.
So primarily a sun issue for the pale-nosed ones, but
Oh,
maybe other factors are involved for some breeds like Labs or... Okay, so if someone suspects this, what does it actually look like? Can it be subtle at first?
absolutely. And this is where early detection can be really tricky because initially it can look like much less serious things,
Right.
like just chronic inflammation, maybe a minor wound that won't heal properly, or even just a bit of a crusty spot.
Like they just scratch their nose or maybe have some dry skin.
Precisely. The early signs are often quite subtle. Maybe some mild redness, some
Mhm.
crusting or scabbing that keeps coming back. You might see small erosions, little sores that just don't seem to resolve.
Mm.
Look for a loss of that normal bumpy texture of the nose pad, or the nose maybe losing its natural color, becoming depigmented, and the animal might repeatedly lick or paw at the area.
Okay, those are subtle. And how does it progress if it's, not caught early or addressed?
Then you start to see more obvious and frankly concerning signs. Persistent ulceration, bleeding maybe, even just from minor contact.
Oh, wow.
It can become a raised, solid mass, sometimes described as having a cauliflower-like appearance. It becomes painful, clearly.
Yeah.
And if it starts to invade the deeper tissues or into the nasal cavity itself, you might see nasal discharge.
Right.
And in really advanced cases, you can even see significant facial deformity
Yeah.
because the tissue's being destroyed. Secondary bacterial infections are also pretty common at that stage.
That sounds awful. Are there typical differences in how it presents between cats and dogs? Like, do they tend to look different?
Yes, generally speaking. Cats often start with those more subtle, erosive lesions, the
Hmm.
redness, the crusting, those non-healing sores that sort of flatten the nose texture.
Yeah.
Dogs can present that way too, definitely, but they might be a bit more likely to develop a proliferative, a mass-like lesion earlier on, and potentially show signs like sneezing or even nosebleeds sooner if it involves the nasal cavity.
Got it. Okay, so if you spot a persistent non-healing lesion on your pet's nose, especially if they're pale-colored and enjoy the sun, what's the next step? How is this definitively diagnosed?
Yeah, this is critical. Early and accurate diagnosis is absolutely key for the best outcome. It starts with a thorough physical exam by your vet. They'll have a close look at the nose, feel the lymph nodes, particularly the ones under the jaw.
But you can't tell for sure just by looking, right? Even if it looks really
No,
suspicious.
you really can't. That's why the gold standard, the absolutely essential step, is a biopsy.
Okay.
This is the only way to get a definitive diagnosis. Your vet will need to take a small piece of the tissue, usually using like a punch biopsy tool or maybe a small wedge technique. This typically requires sedation or maybe light anesthesia.
Makes sense.
And it's really crucial they get a good sample. Ideally from the edge of the lesion, including both the abnormal tissue and some adjacent normal tissue, and importantly, deep enough. A superficial scrape just isn't sufficient to see what the cells are really doing underneath.
And that tissue sample goes off to a specialist, I assume.
Yes, exactly, to a veterinary pathologist for histopathology. That means they look at the cells and the tissue architecture under a microscope.
And they confirm it's SEC.
They confirm whether it is indeed SCC, and they can often tell you its grade, like, is it in situ, meaning very early, and just confined to the surface? Is it superficial, or is it already invasive, growing deeper?
Okay. So after confirming it is SEC, is there staging involved, like checking if it's spread?
Right. Staging is important. It assesses how deep the local invasion is and looks for metastasis, though as we noted, spread is uncommon, especially in cats.
Right.
So standard staging often includes thoracic x-rays, usually 3 different views to check for that rare possibility of spread to the lungs. Assessing the regional lymph nodes is also important.
Even if they don't feel swollen.
Yeah, even if they don't feel enlarged. Your vet might recommend aspirating them, that's getting cells out with a fine needle, just to check for microscopic spread. This is particularly relevant for dogs, where it might be a bit more likely than in cats. Sometimes removing a lymph node might even be necessary.
What about advanced imaging, like CT scans or MRI? Is that always needed?
This is a really key point of divergence based on the sources, particularly between species.
Oh.
Advanced imaging like CT or MRI is considered pretty crucial for dogs, especially if there's any suspicion it's invaded bone or deeper structures. That detailed view is vital for surgical planning to make sure they get clear margins.
Okay. Makes sense for planning surgery.
But for cats, it's often not needed unless deep invasion is really suspected. And that's precisely because their metastatic rate for this specific cancer is so low.
Wow, that's a super interesting difference. The imaging need really depends on the animal.
Yeah, it really highlights how the tumor can behave differently in each species.
You mentioned earlier it can look like other things. What are some of those conditions that might fool you just looking at it?
Yeah, knowing the differential diagnoses, the other possibilities, just reinforces why that biopsy is absolutely non-negotiable.
Right.
Conditions that can look very similar include simple sunburn, which is actually called actinic dermatitis. And importantly, that's considered a precancerous change. It can turn into SCC.
Ah, good to know.
Also, certain autoimmune diseases like discoid lupus erythematosus or pemphigus foliaceus. Then you've got fungal infections, bacterial infections, just simple trauma, or even a reaction to a foreign body lodged there.
So lots of possibilities.
Pretty much anything on the nose that doesn't heal up within a couple of weeks really needs a closer look, and probably that biopsy.
Okay, so we know what it is, why, and who gets it, what to look for, how it's diagnosed. Now, the big question, how do you treat it?
Right, treatment. The guiding principle here is aggressive local control. Because it's primarily a local problem, the most effective treatments focus on eliminating the cancer right there on the nose.
And what's the primary treatment approach generally?
Surgery. Specifically, a procedure called a nasal planectomy. This is often considered the treatment of choice if you're aiming for a cure.
Okay.
It involves surgically removing the entire nasal planum, the nose pad itself, along with a wide margin of healthy tissue around it to try and get all the cancer cells.
Removing the whole nose pad. Wow, that sounds like a major change for the animal. How do they adjust to that?
It is certainly a significant cosmetic change, and yeah, it can look dramatic initially. However, the sources really emphasize that animals adapt remarkably well.
Really?
Yeah, their ability to smell is usually unaffected, and they learn to eat and drink without difficulty. They can lead completely normal, comfortable lives after the surgery. It's quite impressive how well they do.
That's actually a huge relief to hear they adapt so well. Okay, so surgery is a main option. What are the other key treatments?
Radiation therapy, RT, is another very important option. It can be used as the primary treatment, maybe if surgery isn't possible or perhaps not preferred by the owner, or it can be used after surgery.
Ah, like a follow-up.
Exactly, particularly if the margins of the tissue removed weren't completely free of cancer cells. The radiation helps prevent recurrence in that spot.
Are there different kinds of radiation used for this?
Yes, there are. External beam radiation therapy, where the radiation is delivered from a machine outside the body, is a common approach for curative intent. But there's also a type called brachytherapy.
Brachytherapy.
Yeah, using something like strontium-90. This is a really fascinating approach, especially for small, superficial lesions.
Why is that one different or particularly notable? What does it do?
Well, brachytherapy involves placing the radiation source directly on or very close to the tumor surface. With strontium-90, it delivers a highly focused dose of radiation, but it only penetrates a short distance.
Ah, so it's very targeted.
Incredibly targeted.
And
It's super effective for superficial tumors because it can kill the cancer cells right there with minimal damage to the underlying bone or cartilage.
the sources mentioned something pretty remarkable about that for cats, didn't they?
Absolutely. This is one of the standout findings. For small, superficial nasal planum SCC in cats treated with strontium-90 brachytherapy, the reported response rates are very high, and survival times are exceptionally long.
How long?
The sources mentioned median survival times of over 8 years.
Over 8 years. That is incredible. For a cancer diagnosis,
Yeah,
wow, that's practically getting their full lifespan back in many cases.
it really is astounding.
What is it about that specific combination, superficial tumor, cat, and SR90, that yields such amazing results?
It really seems to be the perfect storm of positive factors. You've got the tumor caught very early before it's invaded deeply. You have cats who, in general, have that naturally low metastatic rate for this particular cancer anyway.
Right.
And then you have the SR90 brachytherapy delivering that incredibly potent, highly localized dose precisely where it's needed. It effectively eliminates the tumor without causing significant damage to surrounding tissues or requiring major surgery. It's a powerful example of tailoring the treatment perfectly to the situation.
That really highlights the importance of catching it early and the nuance in treatment options. Amazing. What about other local therapies? Are there others mentioned?
Yes, for small lesions, other options that might be considered include cryosurgery, that's freezing the tissue, photodynamic therapy, PDT, and also electrochemotherapy, ECT. ECT is apparently showing some promise, particularly in cats.
Okay.
However, the sources generally suggest that the cure rates with these modalities might be a bit lower compared to definitive surgery or radiation, especially for more advanced or larger lesions.
Gotcha. Are there treatments you would typically not use for this specific cancer?
Yeah, given the low metastatic rate for localized nasal planum SCC, Systemic chemotherapy, those are the drugs that travel throughout the body, is generally not indicated as a primary treatment.
Okay, that makes sense if it stays local.
Exactly. And topical chemotherapy creams can cause pretty severe side effects on that sensitive area and are usually avoided.
Hmm.
Of course, supportive care like NSAIDs for pain or inflammation, and maybe antibiotics if there's a secondary infection, are often used alongside the main cancer therapy.
Okay, so considering all these treatment options, surgery, radiation, especially that SR90, what's the typical outlook? What's the prognosis for an animal diagnosed with nasal planum SEC?
Well, the good news is that with aggressive local treatment, the prognosis is generally considered favorable to very good.
That's great to hear.
Yes, significantly better than for SCC found in some other locations, like maybe inside the mouth, which tend to be more aggressive overall and more prone to metastasis.
Can you break down the prognosis by species? Is it different for cats and dogs?
Certainly. For cats, as we've touched on, the prognosis is generally very good with surgery, external beam RT, or cryosurgery. And as we just discussed, exceptionally good for those superficial lesions treated with SR90 brachytherapy. We're talking median survival times, often exceeding 600 days for surgery RT and potentially surpassing 8 years for those specific superficial cases. High local control rates are expected.
Very good for cats. And for dogs.
For dogs, the prognosis is also considered favorable with local treatment. Reported median survival times are often over 450 days, so still quite good.
Okay.
However, some studies do indicate slightly higher local recurrence rates with surgery alone in dogs compared to cats, maybe around 25% in some reports.
Mm.
Also, for dogs that present with deeply invasive disease, the prognosis can be less favorable than for superficial lesions, or maybe when compared to the generally excellent outlook for cats.
So still favorable overall for dogs, but maybe a bit more variability depending on how invasive it is.
Exactly. Still favorable, but perhaps with a few more caveats compared to the typically very good outlook for cats.
Okay. Favorable for dogs, very good for cats, especially if caught early and superficial. After treatment, what's involved in, living with the changes and the follow-up care?
Yeah, post-treatment care typically involves regular checkups with the vet, usually maybe every 3 to 6 months initially. They'll monitor the healing process, check carefully for any signs of local recurrence right there at the site, and reassess those regional lymph nodes again.
Right, ongoing monitoring. And now, for the part that feels, I guess, most empowering prevention, how can owners actually help reduce the risk of this cancer developing in the first place?
This is absolutely crucial, both for preventing a first diagnosis and also for preventing recurrence or maybe new lesions developing in animals that are susceptible. And the single most important thing you can do based on everything in these sources is limit sun exposure.
Simple as that, huh? Limit the sun.
Pretty much.
How should someone implement that practically? What does that look like day to day?
Well, the key is to try and keep susceptible animals,
Yeah.
especially those light-colored cats and dogs we talked about indoors during the peak UV hours.
Sure.
Typically between about 10 a.m. and 4 p.m. That's when the UV radiation is strongest. If they're going outside during these times, make sure they have abundant access to dense shade. Not just patchy shade, but good, solid shade.
Okay. Avoid peak sun, provide good shade. Are there any other layers of protection mentioned?
Yeah, pet-safe sunscreens can be applied to vulnerable non-pigmented areas like the nose, maybe the ear tips. You have to make sure they're pet-safe, of course.
Of course.
And here's that curious detail again mentioned in one source. Theoretically, tattoos on non-pigmented skin areas might offer some UV protection by adding pigment.
That tattoo thing is so interesting. Probably not a mainstream recommendation, but fascinating that it's mentioned.
Definitely not mainstream, but yeah, a thought-provoking concept from the source material about how much that pigmentation matters.
But yes, the main practical message is loud and clear. Sun protection is really paramount for prevention.
It truly is. Understanding this strong link to sun exposure is so empowering because it means this is often a preventable cancer, or at least one that can be treated very effectively if you detect it early.
So just to wrap up the key points for any pet owner listening, what are the absolute need-to-know takeaways about nasal planum SEC?
Okay, I'd say think of these key points. First, there's a very strong link between this specific nose cancer and sun exposure, particularly in pets with light-colored noses or fur.
Got it. Sunlink.
Second, it's aggressive locally, right there on the nose,
Yep.
but usually doesn't spread widely through the body.
Local problem mostly.
Third, there are highly effective treatment options available, like surgery and radiation. And importantly, animals adapt really well to the changes, even major surgery like removing the nose pad.
Good treatments. Pets adapt well.
Fourth, The prognosis is often good to very good, especially with early diagnosis and that aggressive local treatment we talked about.
Good outlook, especially early.
And finally, perhaps most powerfully, prevention through limiting sun exposure is your best strategy. And always, always have any persistent, non-healing sore on your pet's nose checked by your vet promptly. Don't wait on that.
Excellent summary. That wraps up our deep dive into nasal planum squamous cell carcinoma, a sun-induced cancer that specifically targets the nose pad, particularly in our pale-colored companions.
And the overriding message really is that while aggressive local treatment offers a very favorable prognosis, often leading to long, healthy lives, simple, consistent sun protection is an incredibly powerful preventative measure. And yeah, don't overlook those subtle changes on the nose. Early detection makes a huge difference.
It really does make you pause and, I don't know, look at your pet basking in a sunbeam a little differently, doesn't it?
It is.
You know, given how vulnerable these specific areas like their nose or ears are to UV damage, it makes you wonder what other subtle environmental factors might be slowly impacting their long-term health in ways we're only just beginning to appreciate. It kind of shifts your perspective on their little world.
It really does. Food for thought, definitely.